Parents, thanks for coming, and I really appreciate everyone's attendance tonight. I am not here to try and scare you. I just want you to be aware of the risks that are involved with the participation of high school sports. There is always the potential for serious injury, but we feel like with proper training and equipment, this will greatly reduce the risk. This is why I feel so strongly about our athletes getting a full pre-participation physical evaluation, as well as being covered with some type of insurance policy. We employ 2 full-time athletic trainers that are very qualified to rehab and treat your athletes. And here are some of the most common injuries involved with high school sports. First, traumatic or acute injuries are physical wounds, and they account for most injuries in contact sports because of their active, high collision nature. The most common traumatic injuries are sprains and strains of ligaments, tendons or muscles, often at the joints such as ankles, knees, fingers, and wrists. A contusion is the medical term for a bruise that is a common traumatic injury, usually resulting from a hard blow to the body. Small blood vessels are damaged, which causes bleeding within the tissue, which is called a hematoma. A lot of times we see this as a common bruise, but sometimes it's much deeper down in the muscle tissue. Other traumatic injuries include wounds such as abrasions or puncture of the skin, bone fractures, and dislocations. In sports medicine, an acute catastrophic injury is described as a severe trauma injury to the head, spine, or brain. Concussion is a traumatic brain injury that can leave a patient with temporary memory loss or loss of bodily function. This has become a major issue in sport recently, as studies now connect concussion injuries with not just short-term issues, but also long-term medical problems. Dehydration, heat-related illness, can happen when athletes don't stay hydrated or start practices or games fully hydrated. This can lead to heat exhaustion as well as heat stroke. You should get a water break you should get one water break for every 20 minutes of play is what I was trying to say. Chronic injuries or overuse injuries can happen after playing a certain sport or doing an exercise for long periods of time. You really see overuse injuries from athletes that typically specialize in one sport, and that's why we encourage all of our athletes to try to be multi-sport athletes. That way they can stay away from these chronic injuries and overusing the same muscles all the time. You know, there are some preventive measures that we can take to try to prevent a lot of these injuries, and here are just a few. You know, I really feel like if you will go through the proper warm-up, this will really help reduce the risk of injuries. If you will allow your athlete to take at least 1 day off per week, this allows the body plenty of time to recover. And really, 2 days off a week sure wouldn't hurt anything. I think that would be very, very useful. If you wear the corrective protective gear, this will drastically reduce the chance of injury as well. Using the correct technique that they have been taught for a sport or exercise, this will help reduce the chance of getting injured. By taking breaks and drinking plenty of water during and after exercise, overheating can be reduced as well. And that's where I mentioned that for every 20 minutes of practice or exercise in the heat, we need to take a water break. And I mentioned, we have 2 full-time athletic trainers on staff through Cox Health Systems, and they are highly trained, and they are there to monitor the coaches and to make sure that they take breaks every 20 seconds. The Missouri State High School Activities Association also has protocol in place for coaches as well for heat-related illness and dehydration, as well as a concussion quiz or training that all coaches are required to take to become certified or qualified in their coaching training. So this kind of wraps up some of the injuries that we deal with in high school athletics. And I want you to know, like I said, I'm not here to try and scare you. I just want you to be aware of what can happen anytime you participate in a sport or activity, and especially one that allows for a lot of physical contact. I appreciate your time. I hope you guys all have a good evening. And if you have any questions, feel free to call me anytime, and we can discuss or talk about anything. Again, thanks.